A worker made a mistake, and a billboard collapsed. It happened to fall on a little boy who was standing below. The boy's parents rushed over and cried for help. When the doctor checked, he found the boy was only injured near the vein in his neck. As long as the bleeding stopped in time, his life was not in danger. Suddenly, a young man said the doctor pressed the wrong spot. He hurried forward and corrected the doctor. At the same time, he began to check the boy himself. He found that the boy's abdomen had been pierced by glass. The doctor asked in surprise who he was, but it was clear this man was an excellent doctor. He could see the organs and blood vessels inside the body with his eyes alone. He soon noticed that the boy's left lung was damaged, causing a traumatic pneumothorax. If they did not save him at once, the boy's life would be in danger. The young man quickly collected simple tools for surgery. Then he opened a bottle of whiskey. He poured the strong liquor on the boy's chest to disinfect. He put on gloves and cleaned the area skillfully. Next, he cut a plastic tube with a knife. He pushed it into the bottle and sealed the mouth with tape. In this way, he made a simple one-way valve. He cut a small opening with a knife. He inserted the tube into the boy's chest cavity. At once, bubbles came out from the liquid inside the bottle. The trapped air in the boy's abdomen was released. Soon, the boy could breathe again. The boy's parents finally breathed a sigh of relief. Even the people around applauded the young man. Then he went with the boy in the ambulance. But on the way, he noticed a change in the boy's heartbeat. The nurse beside him did not care. When they reached the hospital, the young man urged a female doctor to do an echocardiogram. But after reading the report, she said the boy's heart looked fine. The young man wanted to explain more, but the guard stopped him and pushed him out. Inside the operating room, the doctors praised the device he had made. The female doctor asked if they should do an ultrasound. The chief surgeon said it was not necessary. Outside, the young man was still trying to enter, but guards blocked him everywhere. During the surgery, the chief surgeon suddenly saw the boy's heartbeat change. He asked the female doctor why she thought of doing an ultrasound. She explained that a young man told her to, so the chief surgeon ordered the test. Later, they found the young man and asked why he wanted the ultrasound. The sudden question made him unable to speak for a moment. With the female doctor's guidance, he explained that he saw the vibrations in the electrocardiogram, so he guessed the boy might have pericardial effusion. That could stop other organs from working normally. Then the chief surgeon got a call. The results showed the boy's ultrasound was normal. The chief surgeon thought they were wasting time, but the young man insisted there was still a problem. The female doctor noticed his skill and took him into the operating room. When he saw the boy's scan, he suspected small glass shards were inside the body. In the end, the doctors removed a tiny piece of glass from the boy. The boy's life was saved.